We're here again, and of course, we're talking about another disease. But like you already know, if you're a returning subscriber, we're not preaching doom and gloom. Rather, we're showing you how not to die. In today's episode, we're going to be discussing how not to die from brain disease. And we're continuing with the third chapter of the book, How Not to Die, Discover the Foods Scientifically Proven to Prevent and Reverse Disease. And it was written by Michael Greger. Hello and welcome to Pharm Glo's Clinic, your number one stop for everything on health and wellness. Make sure to subscribe to this channel and don't forget to click on the notification bell. Also, please give this video a big thumbs up, and if you ever have any concerns, questions, or opinions about the video, don't be shy. Just leave a comment down below. Now let's get into the video. There are different types of brain disorders. Among the main categories of brain diseases including infections, traumas, strokes, seizures, and tumors. The most common brain disease, however, is Alzheimer's disease. Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and brain cells to die, a slow process called atrophy. Alzheimer's disease is the most prominent cause of dementia, which is defined as a progressive deterioration of cognitive, behavioral, and social skills that impairs a person's capability to operate independently. In the United States, approximately 5.8 million persons aged 65 and older have Alzheimer's disease. 80% of them are 75 years of age or older. Between 60 and 70% of the 50 million or so dementia patients globally are thought to have Alzheimer's disease. This horrible disease can turn the sweetest person into the most violent person, and it is a very terrible way to die. The majority of strokes can be considered brain attacks because, like heart attacks, blood flow to certain areas of the brain is cut off by rupturing artery plaques. Alzheimer's, however, is more like an attack on the mind. For both victims and caretakers, Alzheimer's disease is one of the most physically and psychologically demanding illnesses. In contrast to stroke, which can kill suddenly and without warning, Alzheimer's involves a longer, more gradual decline over months or years. Amyloid plaques, which are connected to memory loss and eventually death, form in the brain tissue as opposed to the arteries where cholesterol-filled plaques do. Despite the fact that the pathophysiology of the stroke and Alzheimer's disease differs, one essential factor connects them. Growing research indicates that both of them may be prevented by a continuous, healthy diet. A portion of the brain loses blood flow in roughly 90% of strokes, depriving it of oxygen and killing the area that is fed by the clogged artery. It's known as an ischemic stroke, from the Latin word ischemia, which means blood stopping. Hemorrhagic strokes, which only make up a tiny portion of strokes, occur when a blood artery is ruptured and causes bleeding into the brain. The location of the brain that experienced oxygen shortage or bleeding and how long it lasted both affect the damage a stroke will cause. While those who have a minor stroke may just have arm or leg weakness, those who have a major stroke can become paralyzed, lose their ability to speak, or, as is all too often the case, pass away. The blood clot may occasionally just last a split second, barely long enough for you to detect, but long enough to destroy a little section of your brain. These so-called silent strokes can occur frequently and gradually, worsen cognitive function until dementia sets in. The goal of this video is to help you lower your risk of both major strokes, which can kill you suddenly, and minor strokes, which can kill you slowly over time. Similar to heart disease, a healthy diet can lower the risk of stroke by lowering blood pressure and cholesterol while enhancing blood flow and antioxidant capacity. What kind of food should you take to prevent brain disease? Take fiber. High fiber consumption appears to lower the incidence of colon and breast cancer, diabetes, heart disease, obesity, and overall premature death, in addition to its well-known benefits for bowel health. Recent research suggests that eating a lot of fiber may also help prevent stroke. Unfortunately, less than 97% of Americans consume the minimum recommended amount of fiber daily. This indicates that 97% of Americans consume inadequate amounts of fiber. The only location where fiber naturally occurs is in whole plant foods. Foods derived from animals contain no fiber at all, and processed foods have less fiber. Fiber can be said to be the skeleton of plants. Animals have bones to hold them up. Plants have fiber. Apparently, you don't need to consume too much fiber in order to reduce the risk of stroke. Just adding 7 grams of fiber to your diet each day may reduce your risk by 7%. Different people respond differently, obviously depending on how much fiber they consume. It is simple to increase your daily intake of fiber by 7 grams, which is about the same amount as a serving of baked beans or a bowl of oatmeal with berries. How is the brain protected by fiber? Scientists are not entirely certain yet. However, we do know that fiber helps manage your blood sugar and cholesterol levels, which can help lessen the buildup of artery clogging plaque in the blood arteries of your brain. In addition to lowering blood pressure, high fiber diets may also minimize the risk of brain bleeding. Take potassium. For a large portion of our history, humans consumed so many plants that we absorbed up to 10,000 mg of potassium daily. Today, fewer than 2% of Americans even get the 4,700 mg per day that is advised. We don't consume enough whole unprocessed plant foods, and that is the main cause. What connection does potassium have to stroke? A 1,640 mg increase in daily potassium consumption was linked to a 21% decrease in stroke risk, according to an assessment of all the greatest studies on the connection between potassium and our top 2 killer, heart disease and stroke. Even though it isn't enough to raise the average American's potassium levels to the recommended levels, it is still sufficient to significantly lower this risk of stroke. Eat fruits like oranges, cantaloupe, honeydew, apricots, grapefruit, cooked spinach, cooked broccoli, potatoes, sweet potatoes, mushrooms, and cucumbers. Get enough sleep. Too little or too much sleep is linked to an increased risk of stroke. But how much sleep may be too little? How much is too much? The first serious attempt at answering this question was made by scientists in Japan. For 14 years, they monitored about 100,000 middle-aged men and women. Subjects who slept for 4 hours or less, or 10 hours or more each night, had around a 50% higher chance of dying from stroke, compared to those who slept an average of 7 hours per night. Use antioxidants. Herbs and spices are the food category with the highest average antioxidant content. Consider making a hearty dish of whole wheat spaghetti with marinara sauce. Together, they have an antioxidant power score of about 80, about 20 from the pasta and 60 from the sauce. A few handfuls of steamed broccoli florets could be added to create a satisfying 150-unit supper. Add a teaspoon of dried oregano or marjoram, which is oregano's sweeter and milder twin. The antioxidant power of your meal could increase by up to 300 units only from that. To round up, let's answer this question. Is Alzheimer's caused by genetics or diet? Given that the majority of the popular press today considers Alzheimer's as a genetic illness, this nutritional approach may come as a surprise. They claim that your genes and not your lifestyle decisions determine whether you'll fall by this disease. However, that case starts to fall apart when you look at the distribution of Alzheimer's disease globally. For instance, Japanese males living in the United States have much higher rates of Alzheimer's disease than Japanese men living in Japan. Also, Africans in Nigeria have up to 4 times lower prevalence of Alzheimer's disease than African Americans in Indianapolis. Why does residing in the US make dementia risk higher? The weight of the data points to the American diet as a problem. Of course, in today's interconnected globe, a Western diet can be adopted without having to relocate to the West. The rise in Alzheimer's cases in Japan over the past few decades is attributed to the country's recent switch from a traditional rice and vegetable-based diet to one that includes 3 times as many dairy and 6 times as much meat. So the most important thing you need to do in order to fix your health is to fix your diet as soon as possible. What do you think about the video? Let us know down in the comments section. And that's it for today. Be sure to subscribe to the channel and click on the notification bell, smash that like button, and we'll see you in the next video.